everyone. In today's video, I want to talk about cardiac catheterization. Not only do I want to talk about what the procedure is, but I really want to touch on how you as the nurse will care for this patient before and after the procedure. Please be sure to give this video a thumbs up and let's jump right in. So a cardiac catheterization is an invasive imaging procedure that allows the healthcare team to evaluate heart function. A tiny tube called a catheter is inserted into a blood vessel, usually the arm or the groin, and is threaded into the coronary arteries. Now let's talk about some of the responsibilities of the nurse caring for the patient undergoing a cardiac catheterization, because you will be tested on this in nursing school. So you are going to draw some labs before your patient's cardiac cath, such as troponin, BNP, PT-INR. The troponin and BNP will reveal heart damage or the severity of heart failure. The PT-INR is going to reveal your patient's clotting ability. So again, a cardiac cath may be completed in the arm or the groin. So you may want to assess your patient's radial pulses and pedal pulses so that you can have a baseline to compare to after the procedure. The nurse should also complete a neurovascular assessment using the 5 Ps. Now, if the cardiac cath is going to be an outpatient procedure, you definitely want to assess if your patient has someone to drive them home afterwards. And of course, as the nurse, a lot of your preparation is going to include patient education. There are some key things that you're going to want to teach your patient prior to the procedure so that they will know what to expect as well as how to prepare. Now remember, it is the cardiologist's responsibility to obtain the consent form, explain the procedure itself, including risks and benefits. But as the nurse, you are allowed to reinforce teaching and make sure that the patient knows how to prepare for the procedure. So here are some things you may want to go over and reinforce with your patient that is going to undergo a cardiac catheterization. Explain to the patient that they will be fasting for 8 to 12 hours prior to the procedure. Let your patient know that they will be lying on a hard table for 2 hours. So explain to them that they will be receiving pain management to keep them comfortable. Warn the patient that they may feel a pounding sensation in their chest during the procedure. This happens because once the catheter reaches the endocardium, it can cause the patient to experience extra heartbeats. You're also going to want to instruct your patient to cough and deep breathe after the contrast dye is given. Not only does this prevent arrhythmias, but it also helps the patient to easily clear the contrast dye from the arteries. That sensation usually only lasts for about 1 minute. Explain to your patient that they may also feel a flushed sensation or feel the urge to void after receiving the contrast dye. Explain to them that this is completely normal and usually lasts for only a minute. Now let's talk about the interventions of the nurse after the patient has already received the cardiac cath procedure. After the procedure, you should perform another neurovascular assessment. Look at cath refill, color, temperature, pulses, pain, numbness, and tingling, especially in the extremity in which the catheter was inserted. Look for any changes since your first assessment. Also be sure to compare the affected and unaffected extremities. So for example, if your patient had femoral access, compare both legs. If your patient had radial access, compare both arms. This helps you to catch early signs of bleeding, decreased perfusion, or nerve damage. After the cardiac cath, these neural assessments should be done every 15 minutes for the first hour, every 30 minutes for the second hour, and then every 4 hours until the patient is discharged. Please be sure to check your patient's blood pressure and heart rate during those intervals. Remember that a low blood pressure and high heart rate is a sign of shock. Be sure to monitor the catheter access site for bleeding and hematoma formation. Assess for orthostatic hypotension, lightheadedness, and dizziness. Also be sure to instruct your patient to ask for help before getting up out of bed for the first time after the procedure. Also, monitor your patient for a vasovagal reaction. Signs of a vasovagal reaction include bradycardia, hypotension, and nausea. This reaction can be reversed by elevating the patient's lower extremities or legs above heart level, administering an IV bolus, and by administering atropine, which will increase your patient's heart rate. Also monitor for cardiac-induced nephropathy. This will show up in your patient as an elevated creatinine level. If you see this, begin IV hydration immediately. IV hydration will help to flush your patient's kidneys and increase their urine output. You also want to instruct your patient to report any chest pain or sudden discomfort from the catheter access site immediately. Please be sure to explain to your patient that the extremity in which the catheter was inserted should be kept straight. And as the nurse, please be sure to maintain a clean, dry, and intact dressing to the catheter access site. So as you all can see, the role of the nurse caring for the patient receiving a cardiac catheterization involves a lot of assessment, a lot of patient education. Please be sure to share this video with a friend, classmate, or teacher. Please be sure to give this video a thumbs up. Remember to never give up, and as always, thanks for watching.